want to do training, because you remember when people come out of college, they come out of college with the basic knowledge of the theory and the book, the classroom set work. So then you go out there, they find the field is different. So you need to bring them again to do refresher, and then you're able to train them so that they're able to understand what is happening in their world. Because the technology is changing, you inform them on the technology that has changed and how it's affecting them, so that they're able to use the same knowledge when they go back to their working stations. That will help them. They become more fresh. They're able to handle, share ideas, able to solve problems, and the work becomes easier, and also improve the level of confidence in them. Because you remember, when you're coming out of college, the confidence are also low. But when you go out and meet others, and then you're also trained, your confidence levels go up. And then you're able to take care of this equipment, because the core mandate is to make sure that the medical equipment life cycle is well maintained from procurement to disposal. There are several processes there. And each step has steps you need to be taken one by one, so that you're able to understand and appreciate how it is done, so that you're able to implement the same when you go back to your working station. And that's the only way you can do to ensure that patients or citizens get quality health care through your work of ensuring that the equipment are working optimally and giving the right results. Because if you are not trained again, the equipment might fail, give wrong readings, and lead to misdiagnosis. Then at the end of the day, the clinician or the doctor gives wrong results or wrong diagnosis to a patient, and this becomes very costly to the patient because of an error that you could have sorted out if you are taken for training. So we're also asking the government, all the stakeholders, to ensure that the trainings are done when equipment are bought or procured. The training can be done either factory or on-site training, and this will be a mandatory requirement. As AMEK, we recommend that this should be a core mandate of everyone who is procuring equipment, as well as the government is trained, as well as training the applications at the users, but also do majorly on the biomedical engineers, so that they're able to implement this knowledge in their day-to-day working conditions. We also advocate that the ministry fast-track the process of developing the medical devices management policy, to ensure that this element of training is well integrated in the policy, so that it can be implemented by all stakeholders in Kenya. Thank you very much.